But it wasn't until I graduated college that I had my first more, in-depth in-person experience. I ended up going through this whole journey with cancer myself, Hodgkin's disease. I had to go through chemotherapy and all those things you think about with cancer. And part of that process, it really got me thinking, this is really interesting. I started spending more time around healthcare. I became really interested in the brain. Having gone through a serious health concern, I think it's the empathy part of it, like how scary it can be to not have answers. And it still amazes me, even this many years into it, we have a long way to go. We have millions of Americans that are living with dementia, but don't have a diagnosis. I don't see anyone that doesn't have both mental health concerns over time as well as neurological concerns. And so for me, it was vital to have training in both areas because I didn't want to be in a position where I told the patient, I don't do that. But imagine living with something, knowing something's wrong for years and not having an answer, getting bounced around, seeing different doctors, specialists, etc. And I just loved the feeling of being able to give people answers and clarity. We started just before COVID, so I was able to see my patients from home at a time when a lot of my colleagues were stuck. That's where we thought of, how can we reach more people with a highest quality of care? And we wanted to challenge and break down the barriers of you can get the best possible mental health care virtually from home. We wanted to push the boundaries of where quality was, regardless of location. A big thing that at Frontier we do is we're building systems to impact a larger number of people. And that's the kind of stuff ultimately that gets me excited is I get to see patients, but also I get to spend a lot of my time problem solving and building systems to build in quality for more patients than I can see one by one.